Good morning, everyone.
I think we're ready to go.
Looks like we are. Okay.
Okay, I'm now going to call our annual meeting to order. And I'd ask Kathy to start with the roll call.
Okay. Good morning, everyone. Rebecca?
Good morning.
Present.
Elaine?
Present.
Bella?
Present.
Eric?
Present.
Okay. Martha?
Here.
Dr. Olson?
Present.
Dimitri?
Good morning, Kathy. I'm here.
Morning. Secretary?
Here.
Nancy?
Good morning. Happy New Year, and I'm here.
Oh, great. And Matt?
Yep, here. Thank
Okay.
you.
Thank you, everyone.
Great. Good morning. Well, it's great to see everyone. Happy New Year. I guess we can still say that. The lights are still up on the common. But it's really my pleasure actually to kick off our annual meeting. The purpose of which is set forth in our bylaws, and it's to elect a board chair. Before we do that, I'd like to thank Michael Cherno for long and distinguished service in that role. And I want to nominate Felaine Duronette to be the vice chair of the Health Connector board. As many of you know, Felaine's been a great member of our board and a great voice in helping us remember the people behind the policies that we're setting. She brings a consumer voice and also represents a large, it brings a lot of leadership experience as the vice president of SEIU 1199. And she also serves on the Health Equity Compact. So she's willing to serve. So I'd like to nominate her, and I need a second for that.
Second.
Thank you, Nancy. Now I think, Kathy, we need a roll call.
You sure do. Okay.
I mean, should I ask for discussion? No, I think we'll just go for the roll call.
Okay. Ready. Rebecca?
Yes.
Okay. Bella?
Yes.
Eric?
Yes.
Martha?
Yes.
Dr. Olson?
Yes.
Dimitri?
Yes.
Secretary?
Yes.
Nancy?
Yes.
Matt?
Yes.
Thank you.
Wonderful. Well, the motion's carried. Congratulations, Felaine. Michael, I don't see you on the call, but I really want to, just for the record, thank you for really serving and continuing to serve on this board, but also, but for your time as vice chair. Really appreciate it. It's always good to know that there's somebody backing me up. Just it's a matter of principle. So thanks, Felaine. We look forward to working with you more. Now we need, believe it or not, a motion to adjourn this meeting, which I will offer. I motion we adjourn the annual meeting of the Health Connector. We need a second.
So moved.
Thank you, Matt. One more time, the roll call, Kathy.
Okay. Rebecca?
Yes.
Elaine?
Yes.
Bella?
Yes.
Eric?
Yes.
Martha?
Yes.
Dr. Olson?
Yes.
Dimitri?
Yes.
Secretary Walsh?
Yes.
Nancy?
Yes.
Matt?
Yes.
Thank you, everyone.
Okay, well, now I am calling the regular monthly meeting of the Health Connector board to order. And we need yet another roll call. So Kathy, could you please do that?
Okay. Rebecca?
Here.
Elaine?
Yes.
Bella?
Here.
Eric?
Yes.
Martha?
Yes.
Dr. Olson?
Here.
Dimitri?
Yes.
Secretary?
Yes.
Nancy?
Here.
Matt?
Yes.
Thank you.
And now that we're so well practiced, I'd like to ask somebody to vote approval of the minutes. Chief Elaine, all this can be yours one day.
Move approval of the minutes. This is Matt.
Thank you.
I'll second that.
Do we have a second, Rebecca? Thank you.
Okay.
Okay, Kathy, one more time. But by the time I think we should set this to music, but let's go.
Okay. Rebecca?
Yes.
Elaine?
Yes.
Bella?
Yes.
Eric?
Yes.
Martha?
Yes.
Dr. Olson?
Yes.
Dimitri?
Yes.
Secretary Walsh?
Yes.
Nancy?
Oh, I'm so disappointed I couldn't get to my Spotify fast enough to pick up
Yeah.
the secretary's suggestion, but yes.
And Matt?
Yes.
Thank you.
Well, this is wonderful. I thank you all for your patience with the parliamentary procedures. They're important when we need them, and it's good practice to do them. So thanks for your forbearance and sense of humor, or at least not booing my sense of humor. Before I turn it over to Audrey for the executive director's report, I'd like to offer our official welcome to Dr. Robin Olson, who is joining us for the first time as a Connector board member. And I think Audrey has something in her formal remarks, but just welcome to the board. We make quick work of the boring stuff and often have really good and important discussions, which we'll get to now. So thank you, Audrey. I'll turn it over to you.
Wonderful. Thank you so much,
Robin.
Secretary. Good morning, everyone. It's great to see you all, and welcome to our first meeting of 2024. After an extraordinary 2023, we are very excited to see what the new year brings and look forward to our work together. Before I dive into some updates and previews, I would like to give a warm welcome to Robin Olson, who joins us today for her first board meeting. She was recently appointed by Attorney General Campbell last month to serve as the Health Connector Board's employee benefits expert. Robin brings a wealth of fantastic experience to this post, and we all look forward to working closely with her. Robin, welcome.
Thank you very much. Looking forward to it.
Wonderful. We are just under 2 weeks away from the end of an open enrollment period that got off to a good, solid start back in November and December, as the board knows. Our online application, our call center, our in-person enrollment assisters have all been readily available to members and applicants. With more than 271,000 people in coverage, our total enrollment has now grown by 27% since January of 2023. So far this open enrollment, we have seen nearly 50,000 new enrollments, the most we have ever seen at this point during an open enrollment period. More than 44,000 are now newly in Connector Care, thanks to the 2-year pilot eligibility expansion of the program, including over 37,000 people who are already in Connector coverage but newly qualify for Connector Care, and nearly 7,000 people who are newly enrolled in Health Connector coverage and qualify. In the meantime, we continue to reach and cover people who are found ineligible for MassHealth during the redetermination process and now need new coverage. So far, over 75,000 of these residents have transitioned into Health Connector coverage. We expect to continue to work very closely with MassHealth and Healthcare for All and continue our full-throated outreach efforts through at least the first half of this year as we provide affordable coverage options to everyone who may lose MassHealth. As we look ahead to the foremost priorities that will govern our work in 2024 and beyond, we're excited to come before the board today to review and request your vote on our proposed 5-year strategic plan that was created with input from staff, external stakeholders, and importantly, based on close engagement with all of you on the board over the last year. The strategic plan is meant to be comprehensive and to organize our long game as an agency, but the core of it is straightforward. Make sure that Massachusetts residents have affordable, meaningful health coverage that protects their physical, mental, and financial well-being, and to ensure that the Health Connector is positioned and its work organized so we can excel in our ongoing work to uphold that goal. Our plan includes 4 areas of strategic focus. 1, maintaining and strengthening organizational structure and system reliability. 2, improving equitable access to affordable health insurance coverage. 3, delivering high-value coverage options to the residents of Massachusetts. And 4, improving and modernizing the applicant and enrollee experience. Throughout each of these areas, we continue to center equity in the work that we do for the public. We recognize that both state and federal health reform and the creation of the Connector in the first place were direct policy responses on behalf of the public to an inequitable health coverage landscape that has historically left key populations out of the health and economic protections afforded by coverage. We therefore understand ourselves to be explicitly charged with using the policy, program, and business tools that we have to counter these structural problems as they're encountered in our work. We're grateful to this board for help and support as we continue to refine and strengthen our strategies for doing so. Since you're all familiar with the plan itself, today we'll just briefly review the high-level details of the plan and hope to receive your guidance on the most compelling starting points, areas for us to be mindful of as we start implementation, and how we can best measure progress. I'd like to thank this board for how thoughtfully they engaged with the process of developing this plan to guide the Connector's work for the next 5 years. And I want to recognize Erin and Nuri for leading our internal effort to develop this plan, as well as the cross-functional team of staff that drove the effort. I would also like to extend our gratitude to the 65 stakeholder groups and individuals who were generous with their time and thoughts. offering input as we developed this plan, ranging from consumer advocates to carriers, to sister agencies and legislators, employers and brokers, navigators and community groups. Everyone had a chance to weigh in, and the plan is better for it. Last month, in advance of a member event, we asked members to share stories of how the Health Connector has affected their lives. Reading the many stories that people shared was deeply touching and a reminder of the ways that the work we do every day affects the lives of Massachusetts residents from all walks of life in the most profound ways. Kristen, a single mom of 3, said, quote, "At times I struggled to stay on top of my rent and bills. Because of the Health Connector, I didn't have to worry that my children might not have the medications and services that they needed, no matter what my financial situation." Katya said, quote, "I was raised near Chernobyl. After coming to the United States in 1995, I was diagnosed with hyperthyroidism due to the radiation that affected many nearby cities. The Health Connector helped me find the care I need with specialized doctors that would understand my condition and my care." Robin told us, "The Health Connector has helped me incredibly. A few years ago, I was going through a divorce and had a breakdown. I didn't have health insurance at the time because it cost a mortgage payment through my job and I just couldn't afford it anymore. When I was in the hospital and they couldn't send me to get help because of not having health insurance, someone from the hospital came to talk with me about getting insurance through the Connector. Since then, I've been able to afford health coverage through the Connector and got the help I needed to get back on my feet again. Thank you." As we move into the new year and our ongoing and new endeavors to deliver coverage to people who need it and uphold the mission that the Connector is created to fulfill, these stories help energize and ground us, centering our daily efforts in the vital, life-altering stakes of the work before us and the real lives of those who depend on us. Before I hand back to the Secretary, I also just want to give a quick special shout out to 2 staff members who will be presenting to the board for the first time today, Kirsten Blocker and Nuri Herrera, 2 exceptional members of our team. I know you will enjoy hearing from both of them on their maiden voyages before the board today. So thank you again to this tremendous board for its support and dedication to our shared work. And with that, I will hand it back to you, Secretary Walsh.
Right, I'll find the mute button. Thank you very much, Audrey. I'm really excited to have our discussion about the strategy, and I'll remind the board members that we'll be taking a vote to endorse the strategy moving forward. The next item on the agenda is a presentation and an update on open enrollment, which is in full swing, as Audrey mentioned in her report. And we have a combined team of the Connector with Marissa, Patricia, and Kristen, and MassHealth's Chief Operating Officer, Elizabeth LaMontagne. And I think Marissa is going to kick us off. So
that's right. Thank you, Secretary. Good morning, everyone.
Good.
Okay, so today we'll review the status of Medicaid redeterminations and transitions to Health Connector coverage in the context of open enrollment. As we start off 2024, we have 272,000 non-group health plan members, up 27% from last January. We also have significant changes to the Connector Care program this year, including the addition of 3 new carriers and the expansion to individuals up to 500% of the federal poverty level for a 2-year pilot period. We'll provide updates on enrollment, outreach, and the call center. But first, I'll hand it to Elizabeth to share the latest from MassHealth.
Thanks, Marissa. So providing a quick update based on data through the end of November from our public dashboard. Since April 1st, the MassHealth has initiated renewals for about 125 million members from April through the end of November. As a result, our overall caseload has decreased by about 203,000 members, falling from 2.4 million to about 2.19 million. In November, we saw 129,000 members depart coverage, an expected volume of departures given the redeterminations process had continued, and who we had selected for renewal in August and September. Prior to the COVID-19 public emergency, we had about 52,000 members who departed coverage from MassHealth every month. And since April 2023, we've seen about 57,000 members depart coverage. If we look at the reasons folks are departing coverage, about 38% of disenrolled members lost coverage because we were able to confirm that they are no longer eligible for MassHealth following their annual renewal. About 59% of departures were because MassHealth had insufficient information to confirm whether a member was eligible or not. This information and more is available on our dashboard at mass.gov/MassHealthRenew. When we're thinking about the key aspects of this work moving forward, there were a few things that I wanted to highlight. The first is that in the national conversation around redeterminations, there's significant concern about loss of coverage for kids, with many states seeing hundreds of thousands of kids lose coverage, but this is not an issue in Massachusetts. Based on a report released from CMS, it outlines the national kids Medicaid enrollment, which fell significantly from March through September 2023. In that time period, MassHealth kids coverage had actually increased. And if we look at that trend continuing, we still see MassHealth kids coverage to be generally very stable. Looking at this data from April through the end of November, there's been about a 6,000 decrease in kids coverage in MassHealth, or less than 1% change in our kids caseload. We're also continuing to do outreach to members, making sure that they have the information, the supports, the help they need to continue this process. So our health plans have made over 1.1 million outreach efforts through text, email, calls to make sure members know what actions they need to take at their time of renewal. Through our partnership with Healthcare for All, which is focused in the 15 communities with the most members at risk of coverage loss, we've knocked on over 428,000 doors, sharing information about the redeterminations process. And community-based organizations have held over 2,800 events in their communities as well. We also received federal approval to launch our Health Plan Assister Initiative, which permits for the first time for health plan staff to directly assist members in completing their renewals. This is a great opportunity for folks to have yet another path to get the help they need. Our eligibility notices, including our renewal forms, also recently went live in the top 6 languages for members under 65. Previously, this was only available in English and Spanish. And additionally, throughout this process, despite the increased volume, our customer service supports have continued to manage and perform well for our members. In November, the average speed to answer was about a minute, with an abandonment rate of about 1.7%.
If no
Questions
questions.
to the connector update. Are there any questions? Sorry, Marissa, I think you're just going to ask. Are there any questions for specific to MassHealth for Elizabeth? I mean, it's just kind of a really, we were so worried about this, and I'm just going to do a shameless plug for the MassHealth home team. They did a really good job with a lot of help from the connector and Healthcare for All and others. But I think it's gone as well as it possibly could. Now I've just jinxed us for the last 3 months, but here we are. But thank you, Elizabeth. Any questions?
Secretary Walsh, may I ask a question?
Of course.
Thank you for coming and being with us again, Elizabeth. It's always great to hear updates from you. How does the 2.19 million that we're at the moment compare if we looked like back before COVID? And could you remind us, although I know you've told us before, like where we think we'll end up?
Yeah, of course. Prior to COVID, we were about 1.8 million caseload. So we're still well above our pre-COVID caseload. And we still expect to land around 2 million for our caseload following the end of this process.
Great, thank you.
Of course.
Eric.
Thank you. I was just wanting to follow up on the stats regarding the folks that lost coverage. It sounded like roughly a third or so lost because the state could confirm they were ineligible, but majority lost because we couldn't confirm. Does that reflect inability to connect with people, or just you can't get the appropriate information? Is it language barriers?
Yeah,
majority of people. Yeah,
it's a great question. And it's pretty common across all the states going through this process. We think that there are 2 main groups in this bucket. The first are individuals who know they're not eligible for MassHealth anymore. They're not going to respond. It's a it's a longer application form. And folks who have access to employer insurance who know that they came on to MassHealth during the COVID emergency are no longer eligible. They're not going to take the time to reply. So we're not able to confirm that they're ineligible, but they are. The other bucket are folks who don't respond either because they don't know they're supposed to respond, or they're not able to complete it in time. And that's the group that we're focused on. We expect some of those folks will come back onto the MassHealth caseload. If they reach out within 90 days of losing their coverage, they can not only get back on, but also have their coverage reinstated to their date of when they were terminated, so they wouldn't have a gap in coverage. And we're really focused on looking at how many folks come back on in that 0 to 3 month or 3 to 6 month gap, to see how we're doing on that process.
Thank you. So it sounds like if someone goes to the doctor, they don't get coverage, that's going to be the trigger. Oh, I've lost coverage. And then they've got that 90-day grace period to get back on.
Exactly. And even if they're after that 90 days, they can still come back on. You can join MassHealth at any time if you're eligible. They just won't get their coverage retro reinstated.
Thank you.
I will say one of the goals before I call on Fellaine that MassHealth has set for this year is to reduce that churn that people go through. I mean, I think at one point, I think we led the country in people churning on and coming back within 90 days. So while it's comforting to think we can get people back on, the goal of this process is to have people not go. And then Elizabeth, correct me if I'm wrong. I think we are ahead on enrollment of where we thought we would be when we did this year's budget. Right. I thought, we sort of thought it would land at 1.8 and it's going to be closer to 2 million, which just given the state's fiscal, challenges right now is a number that we're working through as we budget for fiscal year 25. Right.
That's correct. And we did a much slower start to redeterminations to make sure we're thinking through the member process. So in terms of the pace of this, it is a bit behind, but I think we're still planning to land at that about 2 million.
Good, thanks. Fellaine.
Hi, thank you, Elizabeth, for the presentation, and super excited about that health plan assister, that federal approval. I'm curious, what does the timeline for that implementation?
Yeah, it's a great question. We were actually able to start preparing for implementation prior to receiving approval. So that's something that's currently live with our plans. It's still scaling up, but it's something we've been able to launch at the end of 2023. And folks are starting to have that opportunity come through as well.
That's great. Thank you.
Of course.
Great. Hey, Marissa, I think you're up, and I don't see any other hands.
Actually, Madam Secretary, I'm having a hard time raising my hand
Well, then
on
raise your
Zoom.
voice, Dimitri. Yeah, okay.
I just had I'm always concerned in terms of those who are losing coverage and where they're ending up and where they're going. Of the 57,000 that we're losing on a monthly basis, I was curious in terms of what percentage of that group was finding their way to the connector, and whether we tracking that flow with regard to the cohort that's losing MassHealth.
It's a great question. I think you actually tee up Marissa really well on the slide she's pulled up here. So I might hand that to Marissa.
Yes, I'm happy to take that one. And I think it's a really great segue. So thank you, Dimitri. So since our covered protections ended, about 75,000 individuals have transitioned into Health Connector coverage. This is about 23% of those who qualified for a Health Connector plan after they lost MassHealth. It's been pretty consistent since May. We also are observing, as Elizabeth noted, we do see a sizable contingent, another 30,000 who have reported on their application that they have other coverage or have access to other coverage. And we think that there are there's another bucket of individuals who maybe have that coverage or access, but just didn't report it to us. We are continuing to look for ways to learn more about those who aren't enrolling with us, even though they're eligible to do so. We're going to field a survey to that population. We continue to gather information from enrollment assisters anecdotally, and we're awaiting broader market data to see if enrollment is increasing in other market segments, particularly of interest is employer-sponsored coverage. So we also have here some information about how we compare to other states. Our data suggests a relatively strong performance here. This data here is from CMS through September. It shows we're enrolling more eligible individuals than state-based marketplaces overall, and we're pretty comparable to some of our key peer states. I do want to emphasize that each state's approach is very different, and this data is still really evolving. And just a couple important points about Maryland here and their strong performance. They've prioritized redeterminations for people who were most likely to qualify for marketplace coverage in the early months. And they also had their Medicaid agency pause procedural terminations in August as they worked to make some system changes. So their August and September numbers reflect actively engaged people who were probably more likely to enroll after they completed their renewal. So we'll see how that continues to play out. But I hope that answered your question, Dimitri, in terms of what we're seeing come over to us and kind of how we're looking to sort through the people who are not coming through.
Thank you.
And Marissa, if we included the least well-performing states in this, what would that look like?
I would need to go back and check and see who the lowest performers were. We've tended to focus more on the states that have kind of a policy environment closest to ours to make a better comparison. But we could certainly follow up with the state-by-state data for all state-based marketplaces.
I mean, almost by definition, it's the people who didn't take expansion, right?
That is probably true in the FFM states. I think all the state-based marketplace states have expanded, so we should be on equal footing there.
Okay.
Yeah.
Okay.
Yeah, don't do any extra work. I can look that up myself. I thought if you knew off the top of your head.
Okay, thank you. On the open enrollment front, things are going well. We still have several weeks of activity to come. As Audrey noted, our new membership since November 1st is at 50,000 enrollees. That's the highest we've seen at this point in many years. It's the yellow line in this chart on the right. And it's contributing to our overall enrollment growth of 27% since last January. You can see here on the left that we've rebounded from the enrollment declines that we saw when Medicaid protections were in place, and we're continuing to grow. And I just note we're in good company with other marketplaces, many of which are also seeing strong gains. And CMS issued a press release yesterday noting a record high 20 million Americans have selected marketplace coverage this open enrollment. So you saw on the previous slide that Connector Care has grown considerably over prior years, and it's currently covering over 215,000 members. This reflects gains both over the course of 2023 as individuals transition from MassHealth, as well as 44,000 members who are enrolled in the new pilot program for individuals between 300% and 500% of the federal poverty level. On the right, you'll see almost 2/3 of them were previously receiving advanced premium tax credits only, but there were some who were unsubsidized previously and they newly qualify for support, and some who are in Connector Care at lower incomes last year and will continue to have the premium and cost sharing supports that Connector Care offers. We also have about 3,500 members enrolled with the carriers who are newly participating in Connector Care. About 2/3 of them were enrolled with those carriers outside Connector Care last year and were able to maintain their preferred carrier as they moved into the pilot. And we're really, really pleased that these two initiatives coincided to create a smooth transition into Connector Care for our members. We'll provide additional details about these members next month when we review open enrollment more fully. And if no questions, I can hand over to Kirsten.
Marissa, can you just remind us how many people we projected would be in the pilot?
We're pretty close to that. I think we were looking somewhere between like 40 and 50.
Yeah. Okay. Great.
So we're on track.
Good. Thanks.
Okay, thank you, Marissa, and good morning, everyone. On redetermination direct communications, our outreach campaign to newly eligible members has continued during open enrollment as we maximize outreach to people who may need coverage, after becoming ineligible for MassHealth. This messaging is designed to raise awareness of the opportunity to get coverage through the Health Connector, that financial assistance is available to help pay for plans, and to remind people that state individual mandate requires everyone to have health insurance. Along with redetermination specific messaging, people moving out of MassHealth have also received open enrollment deadline information and other as appropriate messaging related to open enrollment, such as about expanded connector care eligibility, to include awareness of the open enrollment period and all the messaging they receive. We plan to continue redetermination focused communications through at least the first half of this year, understanding that people with redeterminations in March may have MassHealth coverage well into the spring and will need assistance later in the year. And if we go to the next slide, for our open enrollment direct communications, as we move towards the final enrollment deadline of January 23rd, we will continue to target eligible but enrolled applicants, including those who are no longer eligible for MassHealth and not enrolled in Health Connector coverage through a variety of communication types. In the week leading up to the December 23rd deadline, people who had not finished enrollment saw or heard more than a dozen messages, and that effort will be replicated in the week leading up to the January 23rd deadline, with messaging updated to reflect the last chance nature of open enrollment. For 2023 members, the bulk of communications work is completed, with auto enrollment and other changes made, tightening our focus on the unenrolled applicants over the next few weeks is really our goal. So next for member communications is around tax filing season. 2023 members are receiving messages telling them to wait until they receive their tax documents at the end of January to file their taxes, with a reminder that if they received a subsidy, reconciling federal advance premium tax credits is required to continue to receive those tax credits going forward. And if we can move to the next slide, along with the direct communications activities, we are using a number of different platforms to increase awareness for both open enrollments and redeterminations. Partnerships and information tabling have worked to target both broad populations, such as signage at TD Garden during Bruins games, or tabling at malls the weekend before Christmas, and also focus groups such as gig economy participants with events at breweries and shared workspaces. Earned media this month will focus on placing op-eds in regional newspapers around the state, highlighting the opportunity for local residents to find lower cost coverage through the Connector Care expansion, and also radio interviews. Navigators will conduct interviews in Spanish, Portuguese, Haitian Creole, and other languages leading up to the deadline. Paid media will continue through the deadline, with advertorials and other ads appearing in ethnic media outlets and broader messaging on the MBTA, digital platforms, and social media. And I am happy to take questions before turning the presentation over to Trish for contact center performance updates.
Kristen, any questions? And welcome to your first board meeting. Well done.
Thank you.
Okay, we'll move on.
Good morning, everybody. Happy New Year. I hope everybody had a good holiday. For the month of December, our call volume increased by about 15,000 from November, continuing our upward trend in volume. We ended the month with over 119,400 calls, which was just about 60% higher than what we received in December of 2022. While the volume did come in under forecast, we had some days towards the end of November where our service levels dipped. Overall, for the month, customer service just shy of 84%. Our abandonment rate, however, did remain very low at just under 1.9%. We have regrouped with our contact center vendor Accenture to take a look at lessons learned from December, have made some changes that have already resulted in positive changes. We're back up to daily service levels of mid to high 90s and feel confident that we're fully prepared to handle the call volume for the last couple of weeks of enrollment. On the next slide, since we did not meet in December, I included the final numbers from the work that Maximus did for us July through November of 2023. In addition to assisting with document processing, Maximus made outbound calls to over 326,000 contacts for us. Over the course of their work, they spoke to or left a voicemail message for over 71.5% of those that they attempted to call. Those not reached were due to no answer, no voicemail, incorrect phone numbers. On behalf of the connector, I want to thank Maximus for their engagement with us and the extraordinary work that they did to reach as many individuals as possible during unwind and open enrollment. Happy to take any questions on the numbers. Otherwise, I can turn it back to Marissa.
Any questions? The numbers seem pretty self-explanatory. Thank you, Trish. I know you make running a call center look easy. It is not. Oh, Eric, thank you.
Thank you, Madam Secretary. Just a quick question on the service level percentage. Can you define what that is? I don't recall.
Yep, so we take a look at the number of calls that come in, the number of calls that are answered, and it has to be, our minimum is 85%. That's what we consider our minimum requirement for the contact center vendor. So it did dip a little bit below that in December, but overall they've met or exceeded the 85%, but it's based on the number of calls answered versus what's come in.
All right,
and on days, if service level dips too low, we actually have them pull a report to see who's called us that we didn't speak to. We actually make outbound calls to make sure that whoever called has their issue taken care of.
How does that differ from abandonment rate?
So the abandonment rate is based on someone that calls in that decides they don't want to wait. So the abandonment rate are folks that haven't waited. The service level, you take a look at how long it's actually taking for someone on hold to have the call picked up. So it's taking into account how long they've waited to be serviced, whether or not they held on the line to be serviced. And we always want a certain percentage of people to have not only their calls answered, but answered within a minimum amount of time. Our speed to answer in December went up a little bit. I think it was 37 seconds. And traditionally it's more in the teens to 20 seconds.
Okay.
Hey, Trish, just to confirm, the folks that you were not establishing contact with on first call, if I heard you correctly, you are getting that list and you are reaching back out to them to make sure that you're communicating with them. So it's, if we factor that in, you almost at 100% in terms of interacting with.
Yeah, I mean, what we try to do is, again, if we have a day when the call volume and the number of calls that we've answered within a certain amount of time, if we've exceeded that to a point that's, beyond what the normal sort of give and take is with the call center, then yes, we do try to call back. And if we get a call from someone that says, hey, I tried to call in, the deadline's coming up, I couldn't get through, we will actually go back and make sure that we retro whatever the issue is that we're taking care of to the day that they made their phone call. So that we're making sure we're taking care of people in a timely manner and not penalizing them if they've taken a couple days to call back or to get back in touch with us.
I just want to make sure that I express this. I want to commend the team for the job that's getting done at the call center, because for those of us who've been on the board for a while, we've seen a lot, and we have come to appreciate very strongly where we are right now and the performance that we're seeing right now from the call center.
Thank you, Dimitri. Yeah, I hope the recording picked that up. No, okay, great.
Thank you, Dimitri.
I think Marissa, we go back to Marissa.
Yep, just to close out, we will be making a full court press through the 23rd to make sure everyone gets coverage who needs it. Once open enrollment ends, we will, as we did in 2023, continue to have extended special enrollment opportunities for people who lose MassHealth as part of redeterminations. We'll also be monitoring for additional data coming out about the broader market trends. So we expect that some DOI and CHIA data should be available in the next few months, and federal data likely later this summer and fall. And we'll report back next month with additional details about how open enrollment ends and its impacts on our enrollment numbers and demographics.
Nancy.
I didn't want Kirsten's inaugural presentation to go without a question that I just thought of. Kirsten, I assume that we have ads all over the MBTA and not just in stations that don't have any passengers in them at the moment. Is that correct?
That is correct. Yes.
And might we think about whether we should be paying for some of the ads that are in stations that have no passengers? I just put that forth for consideration of not the board, but all of you.
I appreciate that, Nancy. Yes, we'll take that into consideration. Thank you.
Thanks, Nancy.
Great. Okay, so the next item, thank you to the team for, first of all, for great work and for a great presentation. This is, largely a good and great way to kick off the year with a lot of good news, but know that, we're here and need to hear the whole story. So whenever there's bad news, we're here as well, and we'll have a longer meeting to talk about it. So, and with that, continuing the good news, we now have the opportunity to take a vote to endorse the health plan strategic plan, just to refresh all our memories and ground us, because the documents had some iterations. Nuri and Erin will take us through through a description of the plan, and at the end we'll call for a vote.
Right, thank you, Secretary. Good morning, everyone. So as the Secretary stated, Erin and I are here today to share with you, and with great enthusiasm, our newly developed 2024-2028 Health Connector Strategic Plan. We are happy to share that after several months of planning and development, we are here to unveil to the public what we learned and what we plan to do moving forward as an organization. But before we begin, we do want to take a moment to thank our members, stakeholders, partner agencies, and Health Connector staff for supporting our efforts and for providing us with their feedback. We also want to thank our board members for your insightful conversations and for the feedback most recently provided. Given your level of engagement, and as we stated already, we do want to remind you that we will keep today's presentation at a high level to allow time for a robust board conversation guided by questions that we have prepared. So today's presentation will cover the process of developing the strategic plan, the core areas of focus, and then we'll open up the floor for discussion. We'll also share our next steps, and then lastly, again, we will request a vote from the board to finalize the plan. In terms of the development of the strategic plan, thank you. There were a couple of stages involved. This timeline here on the screen touches on a few of the important milestones of the process beginning in the spring of 2023, where we conducted individual conversations with each board member to gather initial feedback. We also engaged with other state agencies to learn about their processes for developing a plan. And at the Health Connector, we believe that everyone's voice is important, and we want to make sure that everyone in the agency sees their efforts and work reflected in the document itself. So we actually created and invited Health Connector staff to join a cross-functional work group that we worked together to analyze member data and the feedback we had received. This work group met for several sessions to develop the best approach, the infographic that we will share, and the document itself. And throughout the summer, we held conversations with each Health Connector team, as well as individual conversations with staff. Staff were also given the opportunity to provide input at an off-site all-staff gathering, and I will say that this was the first since pre-pandemic. And this gathering served not only as an opportunity to reconnect with everyone in person, but also it allows staff to identify strengths and challenges of their work as it contributes to the agency's overall goals. In addition to these internal conversations, we also distributed approximately surveys to approximately 200 individuals from 7 broader stakeholder groups, allowing them the opportunity to provide input from their perspectives. And these groups included advocates, navigators, legislative and congressional offices, brokers, employers, carriers, partner agencies, and of course, our board members. And of the 200 solicitations, we received input from over 65 individual respondents, which ultimately contributed to the focus areas, the goals, and the action items that we developed. And once we had gathered that input from our stakeholders, we proceeded to the actual writing phase, the drafting phase in the fall and early winter. And we created a plan that addressed the prevailing themes that we saw. And again, we solicited additional feedback from our board members and Health Connector staff as well. So lastly, that brings us here today to present time at the January board meeting, where we're not only unveiling the proposed strategic plan, but we are also looking forward to a discussion with our board members and your vote to finalize the plan. So if there are no questions at this time, I will pass it on to Erin, who will walk through the core areas.
Great. Thank you so much, Nuri, and good morning, members of the board. I'll quickly just echo our appreciation for all of your individual engagement throughout this process and the Health Connector staff and stakeholder partners for their valuable input throughout the external survey process. So in the interest of time and wanting to really get to those questions that will generate hopefully a robust conversation as to our next steps in implementing the strategic plan, I think we'll really spend the majority of our time focusing on this visual roadmap in front of you. It is a graphic that's intended to be a reference tool and provide direction to the agency and staff, ensuring that these key pillars remain the center of our ongoing day-to-day work and as we take on new initiatives. So what we'll just do again to kind of move through and remind folks is just kind of bundle up this and capture the spirit of each focus area, the goals and related action items in order to leave adequate time for board discussion. So our first strategic area is focused on modernizing and streamlining the experience of applicants and enrollees to ensure that they can obtain and maintain health insurance coverage with ease. A broad range of stakeholder feedback reaffirmed the need for critical improvements to the resident and Health Connector member experience. And we believe that individuals should be able to easily and independently navigate and access Health Connector tools and resources with minimized administrative burdens or bureaucratic obstacles. So again, on each slide is just those 2 goals that we have within each focus area, and then associated initiatives and action steps for the connector. This next strategic area is focused on ensuring health insurance or the Health Connector staff and systems can adapt and grow to reliably meet the needs of state residents and an ever-evolving health coverage, technology, and business landscape. Focusing on the well-being of Health Connector staff and the Health Connector's relationships with stakeholders and vendors, and knowing that that is paramount to the health and success of the agency. And again, apologies for moving through quickly, but we're very interested in, again, kind of having the conversation with board members. And so continuing on to our next strategic area of focus, affordability and the need to continue to work towards equitable access to affordable health insurance coverage was a consistent thread throughout all of the feedback received. And the Health Connector has the opportunity to use available policy, operational, and communication tools to reduce and remove barriers that prevent access to affordable health insurance coverage for all Massachusetts residents. So our 2 goals here are broadly expanding equitable access to affordable health coverage, and evaluating and addressing health equity initiatives through data analytics and community engagement. And then moving on to our 4th strategic area of focus, not surprisingly, access to healthcare services was also a critical concern highlighted during our review of stakeholder feedback, and a critical area for the Health Connector to focus on over the next 5 years and beyond. The strategic area focuses on enhancing affordability for members and those within the merged market to ensure that individuals can use their health insurance coverage to access healthcare services that enable them to attain their highest level of health and financial stability. The Health Connector is uniquely positioned to collaborate with stakeholder partners and sister agencies to work towards innovative solutions promoting healthcare cost containment that has the potential to impact members and residents of the Commonwealth. So again, apologies for that kind of very fast track of those 4 focus areas. And I can certainly pause for any questions But we'll note that the next slide is where we have a few questions for the board to consider and prompt conversation regarding our prioritization of objectives or opportunities in the strategic plan and such. So I'll pause for a moment.
Hi, Erin. Quick question for you. One of the key components as I look at the 4 pillars is that the organization must become even more data-driven in order to achieve the objectives of the pillars. Is there an accompanying technical strategic plan, so to speak, and that's probably something that the team is already working on to ensure that we're also developing the required tool for us to hit our targets with regard to the pillars?
And if I could take the chair's prerogative about capital spend to achieve that, I had the same question, Dimitri, kind of from the other side.
I'm happy to take that one, Dimitri. It's a great question, and the answer is yes. We are, first of all, with respect to the entire strategic plan, obviously this is very high level, and our goal is to come back to the board this quarter with much more detailed work plans that kind of get more into the detailed level of execution. So you'll see the data work represented there. But just at a very high level, I would note that we have actually recently reorganized some of our internal staffing and resourcing around our own internal data, developing a data object model, and trying to bring the connector kind of forward into a more modernized ability to utilize the very rich data we have access to as an agency about our own members, accessing, for example, the CHIA all-payer claims database, and just really deepening our ability to sort of quickly look and pull at and react to data about what's going on with our membership and kind of where we want to be. So that work is ongoing. We're in kind of a transition period right now and bringing in some new resources to help support that work. So we'll have more detail to share, but I just wanted to acknowledge that's been a big area of focus for us over the last year, is recognizing that candidly, we do have some deficits in terms of our data capacity right now that don't meet the moment for the connector.
Thank you, Audrey.
Thank you.
Great question. Thank you. Okay, so happy to again take any additional questions, but as we kind of go into this discussion conversation portion for the board, our first question really is regarding prioritization, and we'd be interested in learning from the board if there are objectives or opportunities identified in the strategic plan that strike the board as most urgent or compelling. And I would also note, in the interest of time, if there are any of these questions that you'd like to take out of order, please don't hesitate to kind of start that conversation as well.
Well, this is Kate. I'll take a stab at the prioritization question. I mean, I was sort of struck by putting kind of the customer first, which I think is because you could we probably went back and forth on customer versus affordability, and so, but I actually think it's a really important statement that, and I think it's something state government doesn't do very well. I know in EHS we spend a lot of time thinking about how many lines we make people stand in, either metaphorically or physically in some cases. And so I think it was an interesting and kind of bold choice for you guys, and glad to see it.
Thank you.
Health insurance is hard enough, I guess.
Yes, it is.
Interesting. Interesting that you bring up the topic of prioritization. I was thinking, boy, it's a lot to do, and how do you get a lot of this stuff done? And I wasn't really thinking in order of time priority. I was thinking in how do you do it all in parallel, and breaking it up into pieces. You take a big project, you always have to break it up into smaller pieces. And thinking as a board, maybe we set up committees or working groups to address different areas of the strategic plan and set up those goals and timelines. And then you as a staff sort of look at the whole thing and make sure it works together. But I don't know that we can do this in a linear fashion. Everything needs to be done, and we just have to break it up into pieces and separate it out by sub-teams. That's my first thought.
And I think sorry about that. You touched on a key point there, Eric, and I think Audrey sort of started to address some of it from my perspective, which is looking inward with regard to the tools that we currently have, or otherwise the underpinning of the tools that we need in order to achieve those goals, and ensuring that that underpinning is solid, and that we're looking at information and processes perhaps a little bit differently than we're looking at them now, to ensure that the end result is all four of the pillars are benefiting from the work that's getting done by the organization.
That's great. We appreciate that, Dimitri. And I think that's very in sync with how we're thinking about it. And Eric, just want to acknowledge your great idea. And we appreciate so much how engaged this board is willing to be and is. And I know there's some topics that we already have some kind of working groups going on. And I think maybe thinking about the strategic plan implementation, we can do that in kind of a more structured way that dovetails with this. And agree with you, Eric. I think our thinking wasn't that we would sequence this, like put some things out at arm's length and say, oh, we'll get to that in 2026. We have to do all of this now and start now, but it's sort of the one foot in front of the other, and doing that in the smartest way possible, I think, is where our head is.
And as we think about our strategic plan and implementation, what measures of progress or key progress indicators would be important for the board to see as we report back to you? And as noted, we intend to come back with that very structured and defined 2024 work plan, and each year with an annual work plan. But in the interim, measuring that progress.
This is Kate. Go ahead. Go ahead. Sorry.
Sorry, I don't mean to monopolize the conversation, but I guess from my perspective, I would like to see staff develop a set of KPIs to report progress to the board, and the set of KPIs that's reported to the board need to be something that starts at the department level, whereas the plan is flushed out some more. KPIs are developed for line managers that are in alignment with the 4 pillars for each of the departments, and we can continue to roll those all the way up until we identify KPIs that will make sense for the board in terms of how progress is being done in achieving the objectives that are being set forth.
That's great. Thank you, Dimitri. Absolutely.
Matt?
Yeah, I'm going to thank you, Madam Secretary. I'm going to have to drop in a moment. I have a hard stop at 10, but I did just want to say 2 quick things. One, to just really acknowledge the excellent work by the staff on this strategic plan and the level of engagement that you had with a variety of stakeholders, including your board. It's very well done. As a peer of Audrey's, I want to acknowledge too that making the strategic plan like this real and having it guide the actual decisions through the organization happens in a really fluid environment, right? So when we talk about prioritizing and the board's role in helping you to prioritize, I want to make sure that we also leave a significant lane and an expectation that the staff and the leadership of the organization, it's really their role to make those decisions real time in that fluid type of environment, right? So there's certainly an ongoing role for the board to help you in that regard, to the degree that, issues come up where you kind of have to make decisions because you can't do everything all at once. That's why it's a multi-year strategic plan, right? None of us have the luxury of being able to put your shoulder behind every single priority all the time. So I think there's a balance there that the board needs to strike to provide the staff that space while being helpful to you in prioritizing as it is needed.
Thank you, Matt. I appreciate that.
Yeah, it's also really well said that our goal is to support management and getting to our job is to support management as you enact and develop KPIs and all the things that Dimitri said. And I think count us as, I think you saw with the feedback you got on the plan that we're very interested in making sure that this is kind of a living, breathing document that guides us all.
Thank you. Thank you so much, Secretary.
I am conscious of the fact that we told people it was an hour. Oh, Eric, sorry, go ahead.
I'm sorry. Thank you, Madam Secretary. I was just gonna add, if you're looking for priorities, one item that keeps coming to mind is affordability, because it hits every other goal, whether it's access, equity, making the process more smoother. Affordability just goes through all of it, and it's not just a matter of subsidies, but looking deeper at what's driving the costs of coverage and what, if anything, can we do, and working with partners and so forth. So I think that's something that's short-term, long-term, and critical to the whole plan, is to really look at affordability of coverage for everybody.
Thank you, Eric.
Elaine and then Nancy.
All right, and being mindful of time, I'll be quick. Thank you for sharing. Thank you for, the opportunity to be a part of kind of the long-term thinking and strategic planning. I would say, what Secretary Walsh's comments around customer first really resonated with me. And in addition to that, in thinking about priorities, what we are offering to the customer is also, kind of equally important. And so really thinking about, prioritization of, that equitable, high quality, low to no cost plans, and all of the deep dives that go into really thinking about it, and debate, and the debates that come with that is important. I will note when Nori shared kind of the process of the strategic plan, the staff went on an offsite retreat, and I know for a fact the deep dives, the critical conversations that goes with being away and together, they're great. To answer the question around updating the board, I'm suggesting for consideration, perhaps a board retreat at some point, halfway through, or some point, to really kind of do that deep dive on updates to the plan, progress, all of that.
Thank you, Joanne.
Nancy.
I think in the interest of time, I'll share my comments offline, Secretary, because I know we're
Okay,
already over.
Yeah, I was optimistic in thinking that given that we had so much good news we could get through quickly, but I've forgotten all the times we have to say our names or say yes. So in that, I think I need to call for a vote to recommend, the language is right in front of me, sorry. Health Connector staff recommend that the board finalize the 2024-2028 strategic plan as described in this presentation, and we've all seen it in writing. So I'll move that. Can I get a second?
Second.
Second.
Thank you. Kathy, we need a roll call on this.
Of course. Okay. Rebecca.
Yes.
Elaine.
Yes.
Bella.
Yes.
Eric.
Yes.
Martha. Did you jump off? All right. Dr. Olson. I'll come back. Dimitri.
Yes.
Secretary Walsh.
Yes.
Nancy.
Yes.
Matt.
I know he had to drop.
Okay, let me try again. Martha.
She might have had to drop too. There's a lot going on in A&F these days.
Okay, and Dr. Olson.
Yes, sorry, I couldn't get off mute there.
All right, thank you, everyone.
Okay, so the motion carries, and now I need a motion to adjourn, which is everyone's favorite motion, so I won't grab it. But
prior to adjourning, I just wanted to state to Audrey, although we want to prioritize the customer, I want to make sure that as we look at customer, we're not just looking at the external customer, but we're also looking at the internal customer for our services, i.e. staff that's working to provide the services, making sure that we're addressing their needs as well.
Absolutely. Thank you, Dimitri, for that call
That's
out.
a really important point.
Yes. Yes. And reflected in the plan and very top of mind for us by design and intention. So I appreciate you calling that out.
Thank you.
And so, Dimitri, can you call for an adjournment now? Move it.
So moved.
Thank you. A second?
Second.
Thanks, Nancy. Okay, Kathy, we do your thing and then we'll be adjourned.
Okay, great. Rebecca,
Yes.
Elaine,
Yes.
Bella,
Yes.
Eric,
Yes.
Dr. Olson,
Yes.
Dimitri,
Yes.
Secretary Walsh,
Yes.
Nancy.
Yes.
That's it. Thank you.
Okay, well, we are adjourned. I want to thank this team for a great meeting, and it's great to see our board members. Welcome again, Robin, and we'll see you all at the next meeting. Good to see you all.